Welcome. Today, we will travel into the past, to an era of early 20th century medicine, to explore a condition known for centuries, alopecia, or hair loss.
Looking at a medical text over a century old, we learn that the term alopecia, of Greek origin, was already defined by the Roman physician Celsus as a lack or deficiency of hair in a certain area. The understanding of the time was that baldness was not just the absence of hair, but the end result of two combined pathological processes: excessive and abnormal hair loss and insufficient growth of new hair. The classification made then remains relevant in principle. It distinguished between congenital alopecia areata, the lack or small amount of hair from birth, often associated with delayed teething. It was mentioned that in people with ichthyosis, hair growth on eyebrows, cheeks, and limbs could remain rudimentary for life. Acquired alopecia acquisita, hair loss that occurs during life. This was further divided into senile alopecia, baldness of old age, which begins in advanced age. It was observed that in men it is much more frequent than in women. The immediate cause was considered to be the decrease in the body's ability to produce new tissue elements specific to aging. Premature alopecia, early hair loss. The most fascinating and mysterious form described is alopecia areata. This is characterized by the appearance of round, completely bald patches, where hair falls out without leaving stumps. Symptoms: the skin on these areas is smooth, white, sometimes slightly reddish. The hair at the edge of the patch is extremely weakly rooted and falls out easily. There is no pain or itching. Progression: the patches can expand and merge. In severe cases, all hair on the head can be lost, including eyebrows and eyelashes, and even fine body hair vellus. The prognosis was considered relatively good. Hair could grow back after a few months or 1 to 2 years, although it sometimes returned initially as fine, pigmentless hair. And known cause: the text emphasizes that the cause is unknown. Factors like general weakness or anemia were ruled out. Although some researchers had found fungi, their etiological role was not proven. The dominant theory was that at the basis of the condition lay a trophic disorder, trophoneurosis, a dysfunction in tissue nutrition, probably of a reflexive or nervous nature, the cause of which remained a mystery. Pseudopelade atrophic alopecia, a rare condition, clinically similar to alopecia areata, but with a different essence. Here, the skin in bald areas atrophies, becoming shiny like satin, and the hair follicles are permanently destroyed. It is an extremely chronic condition that does not respond well to treatment. Neurotic alopecia, cases of hair loss in direct connection with diseases or injuries of the nervous system, are described after herpes zoster, facial paralysis, head trauma, or even after a strong emotional shock. A dramatic case is that of a 17-year-old girl who lost all her hair in a few days after intense fright, the baldness persisting for 2 years. Symptomatic premature alopecia is that caused by organic skin diseases, local causes, scars after severe acne, psychosis, lupus, ulcerative syphilis, or fungal infections, ringworm, which destroy the follicles. Acute inflammatory causes after diseases like erysipelas of the scalp, where all hair may fall out, but usually regenerates. The most frequent form, alopecia furfuracea pityrodes, caused by chronic seborrhea. This is described as the most common course of premature baldness in men. The process is slow first. Fine seborrheic scaling appears on the scalp, then pronounced hair loss. Due to chronic inflammation, the hair follicle's life cycle shortens, and new hair grows thinner and weaker, until the follicles atrophy definitively. The treatments reflect the era, empirical and based on local irritation to stimulate growth. For alopecia areata, irritant alcoholic etheric solutions with carbolic acid, tincture of aconite, cantharides, berberine, mercuric chloride were recommended. Subcutaneous injections of pilocarpine were also used. It is acknowledged that the therapy lacks any positive basis and is completely unreliable. For seborrheic alopecia, treatment addressed the cause: washings with sulfur soap, rubbing with alcohol and salicylic acid, pastes with sulfur. Internal treatment for underlying conditions, anemia. Chlorosis was also recommended.
This foray into an old textbook shows us how much doctors understood a century ago about the complexity of alopecia. From still valid classifications to precise, clinical descriptions of alopecia areata or seborrheic alopecia. They already suspected the role of the nervous system and chronic inflammation. Although their treatments seem crude to us today, they laid the foundations for the observation and research that brought us to the era of precise diagnosis and targeted therapy. The mystery of alopecia areata, with a to an unknown tour for neurosis, continue to inspire in even the 21st century.